right, welcome everyone. We are so happy that you have taken the time to join us here today. And of course, for those of you that weren't able to join us during the live session, we're happy to have you watch this on a recorded version as well too. So I want to first and foremost direct everyone's attention to our chat. Please feel free to utilize the chat, and Brent and I will be happy to try and answer any of your questions as they come through. And I'm really happy to be able to introduce you all to Brent Neely. Brent is one of the chaplains at Ascend Hospice, and he was gracious enough to come on and talk to us about something that I think is an extremely important part of end-of-life care, hospice care, palliative care, but it's the emotional and psychological aspects of end-of-life care. And so often we get very fixated in regards to, blood pressure and vital signs and medications and things of that nature. And it's very important to make sure that we're also addressing the psychological aspects, because, we as people, we have a psychology, and it's very important. And I very strongly believe in a mind-body connection, and making sure that we're addressing the entire person overall, I think, is extremely important. And so I'm looking forward to being able to help to do that with you all today. So, all right, so let's get started with this. So first and foremost, I have to use our disclaimer, of course. So this presentation is intended for informational and educational purposes only. While I am a licensed physician, I'm not acting in the capacity of a physician for this presentation, and the content provided should not be construed as medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding any of your medical conditions. Never disregard professional medical advice or delay in seeking it because of something that you've seen or heard in this presentation. And we're not establishing a patient-doctor relationship through this presentation. Any and all decisions related to your medical care should be made in consultation with a licensed medical professional. So a little bit about Wellspring Healthcare, of course. We believe in the power of compassion, effective communication, and empowering education to transform lives. So this is the reason why we do these webinars. It's to bring information to people so that you can have the information available for you, so that you can make the best decisions for yourself and for your loved ones. So, of course, feel free to keep in touch with us. Our medical assistant, William, can be reached at 816-708-1661. And if you're a facility that is in need of having more providers at your facility, or you would like us to take over medical director services, or if you would like further consultative services, we're more than happy to try and help assist with you. Please don't hesitate to reach out to Brandy. She is our chief operating officer, and her telephone number is 816-708-1658. And of course, you can always reach out through our website as well at wellspringhealthcare.org. Of course, our partners at Ascend today who are joining us, please feel free to reach out to them if you have any questions in regards to hospice, palliative care. They are an excellent team of providers that are there to just help and educate, and they really help to improve the quality of life of all of their patients. Please reach out via email to Christina Cole at ascendhealth.com, or you can reach them on their website. And of course, their telephone number is 816-584-8111. All right, now with that, Brent, let's go ahead and jump on into the emotional and psychological aspects of end-of-life care. So I think, Brent, the first thing that we have to do, of course, is to kind of define end-of-life care. Now, we've done, complete webinars on this topic, but just to give people a brief overview, if you're joining us for the first time, end-of-life care refers to the comprehensive support and medical treatment provided to individuals nearing the end of their lives. So typically in the last few weeks or months, and it focuses on enhancing the quality of their life, managing their symptoms, and addressing the physical, emotional, and spiritual needs of both patients. And we're going to talk a lot about families today too, because I think that that's something that often is left out or is not thought of as the overall comprehensive picture that we need to incorporate. So jumping in, I think that one of the things that we really need to do first and foremost is address the emotional needs of a patient. So Brent, I know that you talk to a lot of patients on a regular basis, and I can imagine they have a range of emotions when they're dealing with a terminal illness, right? Often fear, anxiety, sadness, or even existential distress in regards to their their impending demise, because they now have reached a point where a physician has told them, we can't cure what you have, and we need to focus on making you comfortable. And so, I mean, without going into too much detail in all of these, what are some of the things that you talk with patients when they're struggling with these emotional needs?
Yeah. For part of it is, trying to get to some of the root of it, when they're fearful. Well, what are you fearful of? And not in a, I think sometimes when people ask that question, it's kind of like, well, what are you afraid of? But to genuinely be, what is it about this process that scares you? Is it that you're unsure of what comes next? Is it that is there a next? Is it that you don't want to be in pain and you're afraid that it'll hurt? For some, it's, the anxiety of, well, I'm not going to be able to look after my family when I'm not here. And so really helping them to kind of trace out what is this emotion stemming from? What is it that is causing you to feel this way? And sometimes people are very quick to name that. And other times it takes a little digging. It takes a little playing around. It takes a little exploring to say, okay, like, well, how do you think your family will respond to this? Especially for me, if they're not from a religious perspective, and they're, if they say, yeah, when I'm done, I'm done and I'm gone. Okay, well, where does that fear then come from? And tracing it out, and you find out that their son and daughter have been butting heads, and they're afraid that they're going to die before they see them reconcile.
Mm-hmm. No, yeah. I think those are really, really important too. And you're really bringing up a lot of those existential distress types of concerns, because those are the concerns I think that so many people don't bring up. And I think you did a beautiful job, Brent, of just helping to identify that it's not just about, the fear of death or the fear of pain. It's a lot of different fears, or it's the fear of those interpersonal communication and relationships that they have, or those unreconciled emotions. So I definitely think that those are really important. So I think this is another important aspect, of course, jumping into families, right? Because you kind of touched on this with the son and daughter who are kind of butting heads together, or maybe you have a family member, or son, daughter, brother, sister, aunt, or uncle who maybe isn't as hospice minded, but yet the patient is very focused on saying, this is the end of my life. I accept that. I understand it. And I'm going to try and do that. So we have listed here a few different things that we need to try and help address on the emotional needs of families. So anticipatory grief, bereavement, significant emotional distress, and then providing support and counseling can help their families navigate the difficult journey. But Brent, I'd like you to just kind of touch a little bit on, how important it is to treat not just the patient, but the family in these types of situations. What do you see in your experience on a day-to-day basis having these conversations?
Yeah, so I often, some of the nurses at some of my facilities that I go to, sometimes they'll ask me, they're like, well, what do you do when you visit with, Miss Jane Doe who has dementia and she doesn't even know where she's at? And I talk about, I spend time with her, I provide presence, I do the best I can there. But then I tell them a large part of it is working with the family as well, because they're either dealing with, anticipatory grief, which a lot of people don't know about, which surprises me when they say, like, is it okay that I'm like, I'm already like imagining my grandma or my mom dead. And it's like, yeah, that is anticipatory grief. The grief is coming and your body is already reacting to it and preparing for it and experiencing it. And so I do a lot of work with helping people even name that and to address that. This morning, even I was at a funeral, and the woman whose funeral it was, her granddaughter was there, and her granddaughter just a couple months ago had this baby, just an adorable little baby. And the granddaughter was so upset, and she's like, I don't even know why I'm so upset, but grandma won't be there for her first steps. And so even realizing the loss of future, and helping people see that and name that, and to know that it's okay that you're both, you can anticipatory grief, not only their loss, but even your loss and a loss of experience. And really just trying to help people to recognize that what they're feeling and what they're going through is okay, and that it's
Yeah.
normal.
Normalizing it, Brent. I think that that's so important, because I think so often patients and families look at this as a situation of like, well, this isn't normal, because we don't go through loss on a regular basis, thank goodness, right?
Yeah.
And so this is something that hopefully people only have to experience a few times in their entire life, and not all the time. And so I think that normalizing that certainly does do a great deal to help people. So, okay, I want to talk a little bit about grief and bereavement as well. And so I put up here two different definitions, because I think that it's important to distinguish between the two. So grief is the natural response to loss, and it encompasses a range of emotions, thoughts, and behaviors experienced after the death of a loved one. And it's deeply personal process, and it varies in its intensity and its duration. And it can actually become a medical diagnosis actually as well, if it's an extended process and goes beyond normal expectations. And then we have bereavement, which is specifically referring to the state of mourning or sorrow experienced after the death. And it encompasses the grieving process and adjustment to the life without the deceased. And I thought that was very interesting as the distinction, because it's the adjustment to life. Bereavement is teaching you and teaching yourself how to live without this person being there. And I thought that that was a really important distinction, that you can have both of these things going on at the same time. All right, so getting into the grief and bereavement, right? So we can have some very specific emotional and physical reactions to this. And what you touched on before, Brent, about normalcy, I think is huge. But I also want to bring up a little bit of a caveat, because I think some of these, especially these appetite changes, sleep disturbances, these are the things that we want to kind of be aware of. Like, that's normal at the beginning, but when does it start to get to be abnormal, right? So that we can help people with that. What do you find in your experience, Brent?
Well, and that's a big part. So within hospice, we have bereavement coordinators, people that'll journey beside the family for up to 13 months. And it's part of that reason to kind of watch out for is this grief becoming a medical condition, like you said? Is it becoming more than what is expected in normal? And part of that isn't to like invalidate anybody's experience, but it is normal to grieve. But there can come a point where it becomes, when it's harmful to self or others, is when it's important for somebody to step in and help them adjust to it, to see what's going on, to see if there's not depression or something happening there. Or I tell people I'm a doctor, but I'm not a medical doctor, so I can't speak on some of this stuff, but you might be able to about, there's from my understanding, a legitimate broken heart syndrome, where there's a muscle in the heart that can break from the sadness and the fatigue and the grief. And so yeah, we work with our bereavement coordinators often to make sure that the families of the people we've cared for, that they're taking care of themselves. And if we can help in any way to, because it's normal to have some bad days in the beginning, but if we're 8 months into this and they're still having really bad days, we need to, I'm a big proponent of refer when need to. And so if it's outside of my special areas and my specialties, to be like, hey, let's get you connected with a therapist that can walk you through this or something.
I think that's so great, Brent. And I picked this this picture here, showing someone who clearly is suffering from sadness, and they only have some part of their plate is eaten, and that was an intentional process in regards to looking at this picture. And like you said, it's normal to have those feelings. And you're going to have moments where you can have that sadness just pop into you, at any point in time, because our brain is constantly thinking about different things, and something can just trigger you to think of something else. And it's very normal, but you're right. It should start to get better. And with help and guidance, it should continue to improve. Before we move on, and we're going to move on here in just a minute, because I don't want to take up too much time on this topic in particular, but I have over here relief, especially after a prolonged illness or suffering. And I think this is, I find patients' families, right? This is typically not the patient, but the patient's families end up having this. Not only do they have this relief, but then they have guilt, because they're like, I shouldn't feel this way about my loved one. But when they had just witnessed their loved one struggling with ALS for the past 5 years, and they got to this point where it was horribly painful for this patient to be alive, and they were suffering, and we were helping to alleviate that suffering, of course, with medications and support and counseling. But they knew that that was a challenging time for this patient. It's normal to have that relief as well. And it's okay to say they are now at peace, and they are now, whatever your religious predilection is or absence thereof, they are now without pain anymore. And so I think that that's an important thing to touch base on, because I think that some people don't give themselves grace on that.
Well, I often tell some of the families that I've worked with that I can see that will be a reaction, because I know how heavy it's been for them. It's like carrying a heavy sack. It's heavy. Once you put it down, you feel that relief, and you may not even notice how heavy that had been, but it's, I often remind, especially for home caregivers, that they're doing the jobs of 7 or 8 people full time. They're the nurse, they're the social worker, they're the chef, they're the waiter, they're the activity staff, they're the chaplain, they're the IT person. They're doing all these jobs to help take care of their loved ones. And one of those jobs is more than enough for one person, but to do all of those jobs, and then, there's this relief. Or even, I think of my own grandma. My grandpa had Alzheimer's really badly. And I remember my grandma would talk to me and say, Brent, I just feel so guilty. I just wish he would have a heart attack and go. Because it was so hard to see him no longer be the person he was.
Yeah.
And just deteriorate. And I would talk to him and be like, no, Grandma, like, that's not a bad thing. Like, that is you wanting kindness for him. That is you loving him and saying, I don't want to see this for him. Sure. And so relief. Yeah, I often try to remind our people, like, there's nothing to feel guilty about. Like, this is okay.
That's great, Brent. No, I thank you for sharing that personal story as well too. I think those are great. So, all right. So, grief and bereavement, again, not only do they have these physical and emotional needs, but they also have cognitive behavioral reactions too, right? So patients, families might find themselves crying, or the patient themselves might find themselves crying, or they might withdraw from social activities. And again, those things are normal to a degree, but we don't want to allow those things to create a overwhelming permeation over the whole aspect of care for that patient as well. So I think those things are important. And then family members often, this can sometimes affect work performance. And this is why we have Family Medical Leave Acts. And this is why we have the need for being able to step away from work for a little bit, because you might have difficulty with concentrating. And hopefully your employer will be, understanding of that as well too. But again, if that's starting to impede your work performance, you need to seek out help from a number of different resources. And we're going to talk about some more of those resources, and I want to get to those in a minute. But I think it's really important to make sure that people recognize that these things are okay and they are normal, and to expect them. Because I think that's another thing too, is that especially if it's an expected death, people think that they're not going to grieve quite as hard. They're not going to have all those types of problems because, well, this was expected. And it's like, well, you're still going to go through all of these emotions, and it doesn't matter if it's expected or not.
And I tell people, even for an expected death, we as humans, there's something in us, whether we're religious or not, there's something in us that tells us death is not right. And so even when it's expected, it's still a shock to the system. if you're about to be in a car accident, and even though you see it happening, your body's still going to respond. You're still going to be in a car accident. And so
You certainly are. Yeah, absolutely, Brent. Well, speaking of support systems, I really wanted to highlight these because I think these are some great ideas here. So we have support systems, and I broke this down into three major categories, right? So we have our family and friends category, we have our professional services category, and then we have our spiritual care category. And so family and friends kind of goes without saying. Those are your best friends, your loved ones. These are the people that are going to be there for you. They're going to hopefully make you dinner sometimes. They're going to be there to just cry with you, because they probably loved this person as well too. And so there's that shared support from that aspect. And I think that professional services is really when we step into the realm of the hospice caregivers, those people that are trained in regards to helping you to deal with these losses. And Brent, as you are well aware, sometimes those people that we lose are not always elderly. And, sometimes they're those 45-year-old people that got a really bad colon cancer diagnosis and they passed away, many years before their time, and that they have young children. And, they need those types of specialized expertise to help them get through that, because I think there is a difference in that situation as opposed to losing, our great grandmother who was 102. We expect that a little bit differently, and we're more prepared for that. But especially like the children, of a young individual, I think are someone that need those types of supports. But Brent, I'd really like you to talk to us a little bit about the spiritual care as well too, because like you said, there are some people that definitely have a spiritual foundation, but there are other people that don't. And so how do you help them to deal with that? Because I do think that no matter what, there's something inside of all of us that pulls at us when we're gone, or we have a loved one that's leaving us. What do you often talk to people about that?
Yeah, so I often try to find out what is important to them. What are the things that matter? What are the stories that shape them? What is the narrative that has directed their life and helped them to be who they are? And so I think of, I've worked with Islamic patients that for them, facing Mecca was really important because of their prayers 5 times a day, and they're supposed to face Mecca. And sometimes, I love the facilities we work with, but not all of them are aware of those needs. And sometimes even just being able to say, hey, it's really important if we can face this bed just towards Mecca. So even though they can't get up, they can still do their prayers in a way that's bringing them peace.
I love that, Brent. That's really nice, because that's something that can really help them to get on to something that's going to make something that's really meaningful and impactful for them. So that's great.
And I think when my time comes, I want people to respect my religious beliefs and help me to complete them. And so do unto others as you would have them do unto you. And so, what is it that you need to be at peace, and really exploring that with them.
I love that. Well, Brent, I knew this was going to be a tight one to fit in 30 minutes, but we're getting down to the end here. I'm just checking that we don't have any questions in our chat. So please make sure if you do have questions, pop them into the chat. But I want to just briefly touch on anticipatory grief, because I think this is a really important one. And you mentioned it a little bit earlier, but it's the emotional turmoil that individuals may experience in regards to the thought of losing somebody. So they haven't lost them yet. And it can create this sense of ambiguity as well. And it's difficult to grapple with that. And then I also think it's interesting too, in preparing for this talk, I was really delving into a lot of these different aspects, things that I don't, as a physician, don't deal with on a regular basis. But I think the role reversal and identity shifting, where they might assume these different caregiver roles, and the kind of pressure that can put on other family members. And so Brent, when you're helping people to navigate these anticipatory grief feelings, what's some of the guiding lights that you help them to reach?
Yeah, so part of it is, working with them to even name what some of the anticipatory grief is. Like with the girl at the funeral, part of that grief was that grandma's not going to be there for this baby's first steps. This baby or this grandma's not going to be there for this. For other people, they have such a close relationship with their loved one that's dying that it's hard to picture what does life look like without that person. So even just beginning to help them to name, okay, what is this grief that you're feeling? What is the anticipation?
Mm-hmm.
Because once we're able to name what that is, it's easier to then say, okay, how do I move forward with this? Now I'm not just feeling this feeling, but I know why I'm feeling it. And if I know the why, we can then begin to do the what.
I love that. If you know the why, you can do the what. I think that's really powerful. Oh,
Yeah.
I love that. So, and you kind of talked about some of this as well, too. Knowing the why gives you the what. I feel that's the open communication, right? That's important in terms of that. I also think that advanced care planning is very important so that way their wishes are already known. So we're not sitting here trying to guess what did mom or dad want,
And then families start fighting because what I want for mom and what brother wants for mom are not always the same thing. And they may not have been what mom wanted for mom.
Exactly. So having those in place, so that just brings us to making sure that everyone does those advanced care planning directives. All right. So the role of the care team, I think this is important. So, facilitate communication, because again, a lot of these family members don't know how to answer these questions, so they don't know how to ask the questions, and we are there to provide those resources. And so the team at Ascend, Brent and his team, Brent, how many chaplains does Ascend have? Do we have together?
I want to say we have 10.
10 chaplains. We have a wide resource, a wide range of experiences that are there to help people as well. And I think that that's important because sometimes they don't even know the questions to ask. And so leaning on that care team is very important, and they can offer that emotional support. And looking for those psychological distresses. And Brent, you mentioned earlier about how hospice and the Ascend hospice team will follow those family members for 13 months after the death of a loved one, so that they can be there to do those check-ins. And I think it's really important for that. So we're coming in hot, but I think we got the vast majority of it covered here. But just to kind of summarize things here, grief and bereavement, there are certainly complex processes, and there's an emotional component to this. There is a physical component to this, a cognitive, and also a behavioral component to this. And that we have multiple support systems that we should be utilizing. So family and friends, we should be reaching out to professional services when needed, whether that's definitive counseling or reaching out to our spiritual leaders as well. And then, of course, anticipatory grief. That's something that I think is huge that we don't talk about enough. And I hope that this webinar gives us the opportunity to start to have those conversations a little bit more with patients and other caregivers, and people in nursing facilities can be aware of those types of things as well too. And I certainly find that healthcare providers of all types, right? So physicians, myself, but also our nurse practitioners and nurses and our CNAs and our patient care techs, all of us have this opportunity and responsibility to offer that compassionate and holistic care and help them to facilitate communication. Because sometimes when people are getting a bath, for instance, that's an opportunity where they're feeling confident and comfortable with somebody, and they can say, that's an opportunity we don't want to ever miss any of those opportunities. So, all right. So thank you so much for joining us, everybody. We've got our next webinar, which we're going to talk about ethical and legal considerations of the end of life. So please don't hesitate to register on our website, www.wellspringhealthcare.org. And of course, you can keep in touch with us at Ascend at telephone number 816-584-8111 or ascendhealth.com. And please don't hesitate to reach out to us at Wellspring Healthcare. William, our medical assistant, at 816-708-1661, or at Brandy Haas at 816-708-1658. And again, Brent, I just can't thank you enough for joining us today, and I thank everyone for coming and joining us as well.